Okay, I'm Dr. Ara Deuk with the Deuk Spine Institute, and I have here with me one of my patients. If you were watching surgery yesterday, he had his Deuk laser disc repair to fix a herniated disc in his lower back. Now, why would you come from Texas to Florida for back surgery?
So historically, I've been very afraid of back surgery, but last year my best friend's aunt saw you. She got the same surgery and she's doing great. So after doing some research and watching some of your online videos, I decided you're the one surgeon in the world I would trust to do it.
Well, thank you. I appreciate that. So you had your surgery yesterday. How was that experience for you?
It was actually a pretty good experience. Not the only kind of painful part to it was just the little pricks in my back when you were shooting me up with some painkillers, and that was about it. Then I went to sleep and woke up feeling great.
Good. Now, you came here and had your back surgery for a reason. What were you experiencing before the surgery?
So I've had over 20 years of just chronic bad back pain that's progressively gotten worse over the years. And a few years ago it just got so bad I had to stop all exercise, I had to stop mountain biking, which is a passion of mine, and even got to a point recently where I had to stop stretching, and lots of sharp pain coming from my low back, running down my leg into my foot. And after the surgery yesterday when I woke up, all of that's just gone.
That's wonderful news. Yeah, we don't have you on any pain medications at this time, correct?
There is one that y'all prescribed, Tramadol.
Have you been taking the Tramadol?
I took it last night.
But not today?
No.
Do you need it?
Right now, no.
Yeah, Tramadol wears off after about 4 to 6 hours. So the one you took last night is gone out of your system.
Right.
So do you feel like you need a pain medication right now?
No.
That's right, because your pain's gone. We give the Tramadol because you may have some incisional pain, but I was mashing on your back a few minutes ago and you didn't have any incisional pain either. So, so you're happy with the results?
Yes, I am.
Awesome.
I'm pretty sure in a few months, a year or so, it's only going to get better.
Yeah, well, we have long-term data that shows 95% on average relief of the back pain even after 6 years on average. So as long as you don't do anything to mess your back up, but you know what you need to do and not do.
Right.
When are you heading back to Texas?
Fly out tomorrow afternoon.
Tomorrow afternoon, very good. So you're going to enjoy Florida for a little bit longer?
Yep, got a physical therapy appointment when I leave here, and then take a little time for Florida.
Good. Well, I would head over to NASA if you haven't never been there. It's only 10 minutes from here, and go check out the NASA and the visitor center. It's pretty cool. They have a rocket garden where you can go see some of the rockets they used to launch.
Nice.
Yeah. All right. Very good. Well, is there anything else you want to say to the rest of the world before you get out of here?
Yeah, if you're afraid of back surgery like I was, this here is the man.
Thank you. I appreciate that. Well, it's not just me, it's a whole team of people.
Yes,
but thank
definitely.
you.
The whole team was great.
All right. Well, enjoy your time here.